Hi, I'm Patricia West. I'm a captain in the United States Navy.
Hi, my name is Kevin Malik.
My name is Agent 1 John Morgan, United States Navy.
Lieutenant Colonel Armando Rosales, U.S. Air Force.
My name is Kevin Malik. I am a Ministry of Defense advisor for the Ministry of Interior. My mission is to advise the Office of the Surgeon General relating to medical facilities. As you know, we're looking to transition the medical facilities over to the Afghans by the end of 2014.
Patricia West. I'm a captain in the United States Navy. I am the senior medical advisor to the Afghan Surgeon General for the police. My team is a group of advisors from civilians and the MODA and military. And what we do is we have been trying to help the Afghans rebuild their entire healthcare system that was destroyed during the Civil War.
I advise the medical facilities officers on how to program, procure, and manage their current construction projects, and also plan for sustaining operations after 2014.
We're starting from zero, and they are now at a point where we have developed a hospital, clinics. We had to build all the infrastructure, the logistics system for medical. We're still working these issues.
So we want to keep a close relationship with all the Afghans at all different levels. So we want to make sure we always keep the Surgeon General informed of his facilities and the changes that are occurring. So typically we engage General Kandahar, Dr. Kandahar, with the overall picture and strategy of how CSTICA funded and managed projects.
We had to establish their financial system and also personnel and training, especially medical training. Preventive medicine, that whole initiative is critical because the fighting that goes on gets all the attention, but the daily sickness from poor hygiene techniques. Some of these policemen and patrolmen have never been given proper personal hygiene training, and they haven't had access to soap and clean water in growing up. So we have to teach them how to prevent simple diseases by the way they smoke a cigarette, wash their hands before eating, after using the restroom, and how to prevent sickness in their COIs and Candex, which would be their battalion and their company.
Lieutenant Colonel Armando Rosales, U.S. Air Force, Public Health, and I'm a Prev Med Mentor with the Afghan National Police. Our strong focus here is to establish something with the Afghan, optimally something that the Afghans have identified themselves, that they are both willing and capable of continuing on with, sustainable, after the 2014, when many of the coalition will depart Afghanistan. We can just maybe initiate some discussions about specifically infection control, not just needle sticks, but also waste handling, hands, and gloves.
Agent 1 John Morgan, United States Navy. I am the A&P laboratory mentor here in Kabul, Afghanistan. At the hospital, I go to the laboratory and I mentor the laboratory chief, which is Lieutenant Muhevla. We talk about lab safety, lab procedures, and we have been starting a bacteriology department. And the bacteriology department is going to help them keep patients safe and help.
Getting my team to the hospital, getting them to the warehouse. We actually go outside the wire pretty far, and getting them there and safely back. When we're doing the driving, we're doing the planning, and we're doing our own security.
Well, in the mornings, every morning we have to do a mission brief. So everybody meets up for a mission brief, tell who's going to be where, tell what all vehicles we're going to take, what routes we're going to take, and then we get out the vehicles. Well, the first thing we do is we check underneath the vehicles. We want to check to make sure there's no bomb. The next thing we do is we do preventive checks on it. We check the oil, we check the lightings, the lights, make sure the Duke's work and our Blue Force trackers are working.
Our missions out to do our everyday work is actually fairly complex. Our commute consists of dealing with city traffic in Kabul, a developing country, with a variety of, I guess it could be best described as chaotic. So we have the component of traffic. We have a component of essentially bad guys out there wanting to hurt us. So we have people focused on the road, getting from point A to point B safely. But we also have our packs, our crew, if you will, and they're assigned to be looking for anything out of the ordinary. It could be a vehicle that looks inordinately heavy, or wiring, or even an individual that might be suspicious. So it's all eyes out on the way to the A&P hospital to do our mentoring, and it's not a very straightforward and simple thing.